Good afternoon. I'd like to call to order the Health and Human Services and Aging Committee meeting, September 21st at 1 o'clock. And can I have a roll call, please?
Good afternoon. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county YouTube page. Calling the roll for Ms. Conwell.
Present.
Mr. Sweeney. Mr. Sweeney is absent. Ms. Turner.
Present.
Mr. Miller.
Here.
Ms. Stevens. Present. We have a quorum.
All right, thank you. I'd like the record to reflect that Councilman Sweeney will not be in attendance today due to personal reasons. So even though it's not a formality to excuse them, I'll make a motion to excuse them. Is there a second?
Second.
Okay, it's been moved by Conwell, seconded by
Turner.
All in favor, please say aye.
Aye.
I heard both voices there, so I was like stuck between the Stevens and the Turner.
That's all right, as long as one of us is written down.
I apologize. Sharon, is there anyone signed in for public comment?
We do have public comment.
All right.
Naomi Ikuda. If you want to step up.
Please come to the podium and hit the green button and state your name. And you have 3 minutes.
I may be out of order. I just don't know how.
Public comments at the beginning, so we'll
Okay,
take,
because I'm,
you can speak to it.
all right, so hit the green button.
Yes, ma'am.
So my name is Nozomi Ikuda from Denison Avenue United Church of Christ and the Haven at Denison. And we're just very, very grateful for the opportunity from the county to
Okay,
apply.
Miss Naomi.
That's why I wondered if I was out of order.
Okay, so, but you signed in for public comment. So public
apologize.
comment, that's okay. So are you going to speak to the actual item that is on the agenda?
Yes, I'm just unfamiliar with the protocol.
That's
I so
okay.
apologize.
So public comment is something else.
All right.
So we'll call you up when it's time for the resolution. All right, Sharon, is there anyone else?
No. No more.
All right. All right, approval of the minutes. Can I have a motion to approve the minutes from the
So
July
moved.
27th meeting? Was moved. Is there a second?
Second?
All right, it's been moved and seconded. All in favor, please say aye.
Aye.
Minutes have been approved. There was no public comment. We have several items that are referred to the committee today. I believe it's 8. Some of them are county administration business. Some of them are ARPA community grant funds. So if we could start, Sharon, with the first item, if you could read into the record, I'd appreciate it.
Resolution 2022-0261, awarding a total sum not to exceed $250,000 to the Cleveland Christian Home for the Cleveland Christian Home Capital Renovation Project from the District 3 ARPA Community Grant Fund.
All right. And again, Councilman Sweeney's apologies for not being here. These are, I believe, the next 3 items that will be read into the record are from District 3. And he has worked diligently and hard with his community to see what their needs are. So who will be presenting for the first item? Please state your name for the record. Make sure the green button is on. And you do not have 3 minutes.
Okay. Want to thank everybody for today. Give you a little bit of a background, Cleveland Christian Home.
Excuse me,
We
sir,
were-
can you state your name for the record, please?
Oh, I'm sorry,
Thank
Charles
you.
Tuttle.
Thank you.
I'm the CEO at the Cleveland Christian Home. We were founded in 1900 as an orphanage. The building that we currently house on 114th, West 114th and Lorraine was built in 24, so it's going to be 100 years old in a few years. We've embarked on a capital campaign to do some major renovations in the building. We've had a lot of background done on the building to make sure that it's structurally sound. And in moving forward, we've decided that obviously the first areas that we want to renovate are those that are considered therapeutic areas. So it's the living areas for the kids in residence, as well as some common areas, the kitchen, the dining room. So we've begun that work and have submitted the application to the county for some additional funding to help us get to the point where we can complete that work. The total renovation budget is $5 million, we're probably somewhere just short of 3.5 million. And once we reach the threshold of 4, we'll be able to get some tax credit realizations. And
All right. I will open it up to any questions from my committee.
What is the total project cost again?
$5 million.
And what are you have a range of sources, and are they scheduled to come in the next 3 years, or?
You know, we've completed what we've considered the first phase of it, which was the renovation of 2 of the residence units, and that has been completed and paid for. So we've kind of been moving forward as we've been able to raise the dollars. We have a number of pledges that, like I said, are getting us up to about $3.5 million at this point. So we're feeling pretty confident
So are you
about.
planning on doing this in 3 phases then?
Well, we've actually finished the first phase, so we're really just looking at the second phase at this time.
Okay. And so when do you think you'll be beginning and completing the second phase?
The goal would be to complete it hopefully to begin it hopefully by the first of the year and complete it at some point during 2023. It includes both the kitchen and the dining area, and the kitchen is a pretty major undertaking.
All right, thank you.
And during the time that you're renovating, how do you work around the population that's there?
Thankfully, I mean, we currently have 6 units, so we house 54 young men at this point. Our census has not been such that it required us to do any thinking along those lines. Initially, we were concerned of it, but with COVID hitting, it kind of took care of some of that. So we've been able to keep the renovated units open so that there's no consumers on those units.
Okay. And so you said part of the renovation was the kitchen and
Dining room?
dining room. Okay. Any other questions from the committee?
No, thank you.
All right. And this is one of my, I'd like to add my name, clerk, because it involves children that are in our care, and they need to have decent living quarters and functioning living quarters. And I know that in Cleveland, although we're very rich with a lot of historical buildings, it's also time to put some money into them, and there's really very limited funding to address those needs with these various nonprofits and agencies. And I've been a proponent of that before I knew COVID was going to happen, or the Arpa dollars. So I've been trying to focus a lot of District 7s on those kind of these kind of projects as well. So I do understand. So I am going to, unless there's anything else you would like to share, the process is for anybody that is going for ARPA funds, will be 3 full readings. So it will pass out of committee, and before you hear anything from the county, it'll be 3 readings. So you're welcome to watch us live stream as it passes through legislation. So I'll make a motion for R2022-0261.
Chair, I'd
Recommend to the full council. Is there a second?
Yes.
Second.
But I really wanted to add my name as a sponsor.
All right. Sharon, if you can add. Anyone else on the
Yes,
committee?
I would like to add my name.
Okay, Ms. Turner?
I'll add my name as well.
All right. All 5 of us, even though Marty's not here, I'm sure he wants his name on there.
Agreed.
All right. So all in favor, please say aye.
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 All right. Thank you very much. Nice to
Thank you.
meet you, Charles.
Thank you.
Madam Clerk, if you could read the next item into the record, please.
Resolution 2022-0263, awarding a total sum not to exceed $25,000 to the Denison Avenue United Church of Christ for the purpose of making capital repairs at 9900 Denison Avenue from the District 3 ARPA Community Grant Fund.
All right. I think that's you. So now you state your name for the record. You don't have 3 minutes.
You have more.
Yes.
So my name is Nozomi Ikuda from Denison Avenue United Church of Christ, and we are so grateful for this opportunity and for the expression of support that being able to make it to this part of the process represents. So thank you so much for your consideration. Actually, Sunday, we celebrated our 125th anniversary as a congregation. Not too many churches in our neighborhood have actually been in operation that long. But shortly after I got there, I found this archive of a church bulletin from 1922 that talked about a church serving people of every race, every class, and creed. So we're now 100 years from that date, but I always thought that was so amazing that a church back in 1922 had that kind of, broad community vision. And the neighborhood there has become only, obviously, much more diverse since that time. And we are very grateful and proud to really serve a diverse community. That's reflected in our staffing, our leadership, and our participation. So to us, that's a real exciting aspect of our work. We try to serve a variety of different kinds of needs. Anybody who comes in, if we can meet the need, we try to do it. Some of them eventually come to church, a lot of them don't. That's really not the issue for us. It's just trying to be a place for the whole community. So some of those needs have included renovation of the gym. I run into people all the time who go like, oh yeah, I used to go to that church. And when you push them a little bit, they're not talking about Sunday morning. They're talking about basketball in the gym. I mean, this is how people come together in different ways. Other people say, oh yeah, I used to come to that, or I go to that church. And what they mean is they come for the food pantry. We also had a homeless shelter. So we've just tried to serve different sectors of the community for a very long time. And so we're really grateful that these funds will enable us to fulfill various aspects of that work. And it's documented in the proposal, but I'd be happy to entertain questions.
All right. So you've already received $25,000 from private donations, $15,000 from in-kind. So the specific function of these ARPA dollars will be for a gym?
Well, actually, we've got a pledge for new flooring, and we've raised the money for a new furnace, which will make the heating of the gym much more, cost and energy efficient. To be frank, though, we've had construction delays. We've been contractors, people have been busy. We've been pushing away at that. So we feel like the gym project is more or less figured out. Regarding the kitchen is mostly done with, 3-part sinks and hard surfaces and all of that. What we didn't quite get to was the Ansel fire suppression system over the stove. We thought we had a quote for $10,000. We got a grant for $10,000, and lo and behold, when that company came in, they said, oops, no, we can't retrofit your hood, and it's going to be another $10,000. So we just were not able to complete that project. So the first priority is really going to be to finish that project, to put the ARPA funding together with the existing grant and finish the stove hood. And then there's just a lot of cosmetic work that's also, important for health. So flooring is very important to us, especially in the area around the gym. We've, since submitting the proposal, we've done a new hallway and, paint here and there. So we've been picking away at it, but it's just a very, long process.
Okay, understood. How do you go about getting your bids, or will this funding already assist contractors that you have already started the work?
Well, we have some neighbors that have been very, very kind and generous. And so if they're able to move forward with that, we would, like to build on existing relationships. Honestly, on the hood, I'm not really wild about the way all that transpired. So I think we're going to be, looking for a couple of different bids for the hood.
Good.
A lot of the other stuff will be volunteer labor. We do have an agreement with somebody who's skilled hardwood guy to help with that. So,
I would like to open it up to my colleagues for questions. Councilman Miller?
So, Madam Chair, Reverend Ikuda, I remember that some time ago we talked about this particular funding process
Yes.
and how it might be approached, and so I just want to congratulate you on following through on the process and conceptualizing it in the right way, and I can state from personal knowledge that Denison Avenue Church provides a wide variety of very important community services. You've run winter homeless shelters. You've provided after school and weekend youth programming through the gym and other programs and just a lot of other stuff. And so I just support the leadership that you're providing to our community, and I would like to have my name added, please.
thank you so much, Councilman Miller.
Any other comments from the committee? All right, anything else you would like to share?
We're just very grateful for this opportunity. Thank you so much for your consideration.
And we're happy that we can help various community projects with these Arpa dollars that might not necessarily happen because of our day-to-day county administration and all the things that we have to take care of. So
Good,
we're
thank you so
making sure
much.
that the community is benefiting from this. Sharon, if you could please add Councilman Miller's name. I'd like to open it up for a motion to pass this to the full council.
Also move.
All right, moved by Stevens, seconded by Miller. All in favor, please say aye.
Aye.
All right. Thank you very much.
Thank you so much.
Resolution 2022-0264, awarding a total sum not to exceed $250,000 to the Centers for Families and Children and Circle Health Services for the purpose of facility expansion at the Centers and Circle Health Services at Gordon Square from the District 3 ARPA Community Grant Fund.
All right. Welcome.
Thank you. Good afternoon. Thank you, Chairwoman Conwell, for hosting us. We're going to talk about this plan that we have to renovate our Gordon Square office.
Please
We
state
did-
your name.
I'm sorry, Eric
All right.
Morse.
We know you, but
I know.
everybody else might not.
We need your
Eric
title
Morse,
too.
CEO of the Centers for Families and Children.
All right.
We did prepare a presentation. I don't know if it's able to be pulled up or not. If not, it's okay. I can just speak to it.
All right.
So do I control it or do they control it?
Sharon will help you.
Okay. Great, thank you. Just a little refresher on who the Centers is. The Centers, we have 12 locations across Cuyahoga County. We have over 550 employees, and we serve around 20,000 people a year. We recently updated our mission to fighting for equity through healing, teaching, and inspiring individuals and families to reach their full potential. And our vision, we hope to go out of business someday, that our communities are equitable, healthier, and prosperous. We have three main lines of business. Our health line, where we started as a behavioral health agency. Now we are also a federally qualified health center. So we provide primary care, integrated care, dental services, nursing services. We're about to actually begin providing infectious disease services, longstanding program for HIV and AIDS, and our syringe exchange program. Our family programs have, up till now, really included mostly our early learning centers and a small program called the Heights Collaborative, which is funded by you all. And now we're about to expand through a partnership with Cleveland Christian Home and adding emergency housing for our youth who are currently staying at the county administration building. So we're excited to move that project forward and add that to the list of services we provide. And then work, we, through a county contract, also provide services to TANF recipients to help them receive training, job placement, and then job retention services. We really see ourselves as a key partner with the county. You know, the things that we believe you all find important are the same things we find important, and that we're actively working on, whether it's the public health, whether racism is a public health crisis, and obviously child and family welfare. So this is the Gordon Square location. It's on Detroit Avenue, right in the Gordon Square neighborhood. It is a historic building. We're working to get historic designation, which would get us additional historic tax credits for it. This picture, though it's really nice, is probably not going to be what it looks like because we can't put that on front of a historic building. But we will be making it much more accessible. Right now, you know, you have to come up a lot of stairs to get into our health center, which is obviously not, you know, not ideal for people with mobility issues, people with health concerns. So we will be addressing that through an entrance that's more accessible for anyone who comes. You know, one of the reasons why we're doing this, and we're also doing a project in Councilwoman Conwell's district, is that we have these great facilities, but when they were established, they weren't established as health centers. So now that we're a health center, we really need to modernize them, update them, so they can become full functioning health centers. The impact of the renovation, we'll be able to separate areas for child and adolescents and adults so that the first floor will be for children and families, behavioral health, as well as primary care, pediatric services, and the upstairs will be for adults with mental illness and substance use disorders. Really excited about being able to expand our behavioral health urgent care center. We have that operating there now in a small way, but being able to incorporate that into these renovations will really help us to be able to serve people. And the whole point of that is that if you're experiencing any behavioral health condition, it's really hard to get an appointment. And so we want to make that really accessible. You just walk in or call and get service the same day. You can even walk out with medications. We'll be doubling our clinical space, so that'll be doubling the number of employees in the building and also doubling the number of people we serve. The retail pharmacy, we have a retail pharmacy in the building currently, but it's inside the building, and you really have to know to get in. So we want to make that available to the whole community, whether you're our client or not. So we're going to front that pharmacy at the center. We're going to be adding women's health and pregnancy centering program. We have an early childhood education center there. We're going to be able to bring that child care center together. Right now they're like split between two parts of the building. We're going to do some renovations so we can bring them into one location. And in this way, we'll be able to really serve the whole family while they're with us for those first 5 years of life at the very least. And then the first Center for the Treatment of Schizophrenia, which is really across all of our sites, and this is really to bring specialized services to people suffering with schizophrenia and their families. You know, it's one of the loneliest illnesses there is for both the individual and the family. We want to wrap all of the best practices around that family. This is kind of the total impact through 2026 if we were able to complete both facilities. You can see it's a substantial increase in the number of people we will be serving, a big increase in our payroll by hiring additional people. There will be low-income jobs really targeted to people who are currently maybe unemployed. This is a view of the inside of the building. Again, this is in flux, but you can see that that first floor, or if you've ever been to the building, there's like an open space under a big silver thing. So we're going to close that in, and that will become our early learning center, connected to the rest of the early learning center. And then areas for, as I said, for child and adolescent, pediatric and behavioral health, as well as adults on the third floor. The basement basement area will also be modernized. That's where our El Barrio program is, and they'll continue to serve individuals and families on TANF to help them, become financially self-sufficient. The total project is probably around $7 million, we believe. We so far have around $600,000 from the federal government and HRSA funds because we're a health center. We've received $100,000 from the Ohio Capital bill, and now this $250,000 from Councilman Sweeney. So happy to answer any questions.
All right, I'd like to open it up to the committee for any questions. Councilman Miller.
I just want to mention that my wife works for the centers,
Okay.
and so out of an abundance of caution, I'm going to recuse on this item.
All right, sir. Understood.
Thank you for exhibiting that ethical position, Councilman Miller. I think that the Centers does really good work across our region. As you know, the Heights is one of my loves. They regularly squeeze a few pennies out of me for their endeavors. So I welcome your expansion in the Gordon Square Arcade area. Having lived over in that direction at the start of my career in Cuyahoga County, I understand the growing needs that direction. Good luck with the rehab of that historic building. That always costs more than you think it will cost.
Yeah.
Those are traditionally money pits. Could you go over the total project cost with me again, please?
Sure.
Total project cost, and then what your potential sources were for the specific rehab.
Sure. So total project cost will be $7 million. With this allocation, that'll put us at $1 million committed so far. We're going after new market tax credits, which would bring in around $1.5 to $2 million. Historic tax credits will bring in about the same. And then we're launching a capital campaign. Actually, I'm having a dinner with my board today to launch the capital campaign, which will raise the additional funds needed to finish the project. Our hope is that the project would begin in late 2023 and wrap up in early 24.
Thank you, Madam Chair.
Are they, so, no phases or anything?
Not at the moment.
Want to do it and get it over with. I gotcha. Doubling capacity of staff, you stated in your presentation. Do you currently have a waiting list of participants?
We do. I mean, the getting access to behavioral health is difficult, and so yeah, there's no lack of customers.
Thank you, Madam Chair. Hi, good to see you again.
Good to see you too, Councilwoman.
Recall our visit to your Midtown location, one of my first outings with Councilwoman Conwell. And just wanted to remind everyone about the increased need for accessible and affordable and high-quality health care, and you're doing that. I was reading through your application, and there was something mentioned about the Gordon Square area being located in a medically underserved area. Can you talk a little bit about that?
Sure. So that's defined by HRSA. And there's maps on the HRSA website where you can see how many of the people in that area are receiving medical services. And there's I'm not sure what the threshold is at Gordon Square, but it is still medically underserved, even with neighborhood family practice, Metro Health, and the Cleveland Clinic and Caroline's are kind of close to the neighborhood. It still remains an underserved area.
That's interesting because I got, thrown off for a second. I mean, we're Cleveland. We have hospitals and medical centers everywhere.
True.
And then finally, let's talk about jobs. What types of jobs are going to be created? How many benefits? Those types of things.
Yeah, so we think we'll be adding around 75 clinical positions. So that's a mix of clinical social workers, counselors, nurses, psychiatrists, nurse practitioners. We'll also need to add about 6 kind of reception or customer service representatives on the second floor. And then case management. So probably around, we'll add another 50 case managers to that neighborhood through this project. And those are people typically with an associate's degree in some sort of related social science or bachelor's degree in a social science.
And finally, Madam Chair, I just wanted to mention that the early learning centers predominantly serve families who are income eligible. And I am a proud graduate of the Head Start program. So thank you for all that you do, and I would like to add my name to this legislation.
Madam Chair, while you're adding names, please add mine.
Add mine as well. Councilman Miller?
I'm recused. That would.
I know, but do you want to add your name?
I don't think I can.
Okay, all right. And of course, Councilman Sweeney. All right, any other questions for Eric?
Thank you.
All right, hearing none, seeing none. I'd like to make a motion to move this to the full council. Is there a second?
Second.
All in favor, please say aye.
Aye.
So that would be 3 yays and 1 recusal.
Resolution 2022-0278, awarding a total sum not to exceed $400,000 to the AIDS Task Force of Greater Cleveland for the Evolution Behavioral Health Program from the District 10 ARPA Community Grant Fund.
All right. Please state your name for the record. Anyone that joins to speak, always state your name, and you do not have 3 minutes. Welcome. Is it the green light on? Green light?
Okay, green light is on. Thank you. My name is Rebecca Strong. I am the Director of Development for the AIDS Task Force of Greater Cleveland. Thank you for having us today. I'd like to introduce my colleagues who are here with me. Our Executive Director, Tracy Jones, our Interim Director of Services, Anthony Forbes, and our Evolution Project Manager, Mikkel Brazil. I will let them take it from here. Also, we have a presentation that we had sent over with slides. No worries. Thank you.
Mikkel Brazil.
So as Rebecca had already mentioned, my name is Mikkel Brazil. I'm one of the program managers at the AIDS Task Force. I've actually been with the agency for almost 15 years, maybe a little bit longer than that. And I've served in the...
Speak just a little louder.
I'm sorry. I've actually been with the agency for about 15 years. I've served in several capacities. I'm actually a graduate of our youth services program in the early 2000s and went on to serve in administrative and direct services capacity. So our youth services are a pretty near and dear project to my heart. Our slides here for our Evolution Project. The Evolution Project is a text-based intervention that we've kind of developed to reach young people in the modes of communication that they generally use. We have young people that don't like to talk on the phone. and
they don't listen to voicemails.
They don't listen to voicemails. I mean, y'all know some of the challenges that go along with trying to, not only, get in contact with young people, but stay in contact with them. And then COVID-19 complicated that matter and made it where we couldn't show up in physical spaces. So we had to get really novel with our approaches on how to reach them and keep them, in their care services or whatever it is we're trying to do with them. So we received some startup funding to create some technology-based services and tools that allow us to send automated text messages to the young people to do things like appointment reminders, medication reminders, finding out what services they kind of need that are creating barriers for whatever thing they need to do. I can't go to school because I don't have a bus ticket. I can't go to this doctor's appointment because I don't have a good way of keeping track of what my appointments are. And so that's what we've kind of started our development work with, and we're seeking this funding to be able to expand that into behavioral health services, kind of coupled with the issues that our young people face. They have a lot of mental health challenges, and they go largely undiagnosed because of a lot of the challenges we know about mental health, just in regionally as well as across the nation. So by creating supportive services through mental health counseling, as well as the wraparound services that we offer at the task force, we hope to be able to reduce the barriers that creates for them engaging with the program. What we plan to do is establish a baseline of what services are kind of necessary. How I'm looking for. How widespread, I guess, that mental health challenges are, to figure out what the best approaches are. We have some ideas because we've offered mental health services in the past, but it was on a much more case-by-case basis. This would allow us to do it in a much more widespread fashion. And so part of this presentation, the last slide that we have on here is a video for our organization, and we can play it in a second. So we'll play that now. Say my last remarks there. Before COVID-19 and before monkeypox, HIV, the virus that causes AIDS, changed the lives of every person on our planet. But even in those early days of uncertainty, we managed to find hope and show love, even in the midst of silence. Now, 40 years later, HIV is still a major public health issue. Luckily, the AIDS Task Force of Greater Cleveland has been fighting HIV for nearly as long. Through cutting-edge medicine, social services, education, research, and advocacy, the AIDS Task Force rises to the challenge to improve the lives of those most impacted by HIV. From LGBTQ communities, youth and young adults, women, and people of color, HIV disproportionately affects the most marginalized amongst us. But we hope that with your help, one day we'll turn HIV from a current event into a distant memory. Join us. Sorry. Thank you for your time on that regard. I want to kind of turn it over to Anthony to kind of talk in more depth about the mental health service.
Good afternoon. Yeah, good afternoon, everyone. Forgive my appearance. Me and the kids were doing produce for the people, passing out fruit and vegetables to the community. So just forgive my appearance. As Miguel said,
Name.
I'm sorry.
State your name.
Oh, I'm sorry. Anthony Forbes, Interim Director of Services at the AIDS Task Force of Greater Cleveland. So what I've been doing with the youth is having what we're calling a candy and conversation. They come in from the big center. I will talk with them maybe an hour at a time, and we just talk about what their day is like, what they've been going through the week. And what we've discovered is not only are there mental health issues, there are domestic violence issues, there's school issues, not attending school, and how do we get you back into getting into school, enrolling into school? As the former director of center manager for the Old Brooklyn Neighborhood Family Service Center, I found that we're able to navigate them through the Medicaid process, through SNAP benefits, and so that has been able to transition them much easier with their medical and with their food insecurities. But our candies and conversation, our behavioral health issues, it allows us to identify their needs, what they are, what they have. I have a young man who is 16 years old who dropped out of the 6th grade, has not been in school since then. And this has been about 3 years. So we're slowly and gradually getting him back into the school system. It is a hard chore to do that, and if you don't have parental support, where do you go and who do you look for? So they've come to the Beyond Identities Community Center having this conversation with me. It hasn't been an easy road as far as them opening up, but now I have my youth coming in and looking forward to an hour conversation with me just to have some place where they can kind of vent, talk about their days, what they have experienced, and how they can move forward. There is so much hope in these young people. They are looking for someone who kind of looks like them that they can relate to. They see me as a LGBT man who is a professional, and they kind of strive for that. And I make sure that I'm there to mentor and monitor their progress. We talk about the domestic violence that's happening in their home, and to be able to have them express that to me is beyond words, because I may not be able to be there with them while they're going through that, but I am there to listen to them and see what I can offer them. What is the plan? We also look at job opportunities. How do we navigate you through the job to get a job? So we have been working with Tri-C with the TRIO program with Dr. Scott, who's allowed us to kind of come in to his world and help the children see if there's a possibility of education. So there is a plethora of issues that they have, but I'm just here as a small part, and that's why we're here today, seeking your support. So thank you.
Hello, my name's Tracy Jones. I'm the Executive Director of the AIDS Task Force of Greater Cleveland, and we're delighted to be here. And thank you so much for entertaining us. And thank you, Councilwoman Stevens, for recommending us. We hope that you find our funding viable, because we know that these youth need assistance. We are seeking this funding to help to bolster this program, to make sure that we have counselors that look like them, to be able to have the young people, as Mikhail stated, that have participated in the program to move on forward. So I will entertain any questions at this point.
Yes, I had one about the text-based program. What was my question? Oh, okay. So how do you go about doing that? Is that an automated system that you have once their name is enrolled, that it texts them all these appointments or whatever? Could you elaborate on that a little
Well,
bit?
he would probably do better, but I'll do it quickly, because I know we've talked a while and we don't want to infringe on further time. And I probably should understand what it is we're doing. This particular program that we're using is homegrown and it was created by Mikhail. And it really, I know we've all gotten a text from university hospitals or another hospital that says, don't respond to this particular message. Well, he's created a system that allows you to respond. So, when the young person, says, well, I can't come to my appointment, and we say, what's the barrier? If it's a bus ticket, we'll send them a bus ticket. If it's an Uber, we'll send them an Uber. If they just need somebody to talk to, they'll be transferred to Anthony or to the other behavioral health specialists that we're hoping we can secure with this funding. But this is to be in real time with the young person and to make sure that, yes, we're starting out to say, we want to remind you about your appointment. But the system has a dialer inside of it that will allow them to have anonymity. So if somebody tries to call that phone back, they won't be allowed to, because every 15 seconds it'll put in another number, so you won't be able to dial it back. Did I get that right, Mikhail? All right.
She knows the program. All right. I'm going to open it up to questions for my colleagues.
Have some comments. Good
Councilwoman.
afternoon. Thank you, Madam
Good
Chair.
afternoon.
Thank you and welcome. We didn't even notice your outfit. You look fine. I recall back in April, I had a conversation with the previous health director, Terry Allen. I think I was one of his last meetings before he retired, and I remembered just being startled and alarmed by the numbers as it relates to Black men and HIV, and was wondering what we needed to do to, get this under control. And we know about marginalization and poverty as mentioned in your application, all of these barriers, the limitations to access to employment and nutritious meals and support. And I just think this is an amazing program. I take my hat off to my colleagues for supporting your application. And just want you to know that I'm supportive. Madam Chair, I was wondering if I could add my name to this legislation, and keep doing what you're doing. You're saving lives. Thank you. Really.
Thank you.
Sharon, I'd like to add my name. This is a sought-after program, this text-based program to engage. I do.
Don't you love the use of technology?
Right. I think it's
Radio-based, meet them
ingenuous.
at the point of their need.
Any other,
Madam Chair.
Councilwoman?
I was so glad that a member of their board brought this to my attention. And after this person held me hostage for a few hours, I had no choice but to follow my heart with financing. It is so sad that in today's world, we are becoming less open to diversity and more controlling of how people operate. It is my belief that my constituents, no matter what their preferences for lifestyles are, should be taken care of and given the opportunities to live better lives. As you all know, I am a champion of education and affordable housing and quality of life issues. And so I couldn't be more proud to make sure that a share of my ARPA money went to support this activity. It's not as substantive as I had originally hoped it would be, but it's still substantive, and I hope that we see a great cohort of young people who benefit from this. I hadn't heard the story before about the young man who dropped out of school in the 6th grade. He barely knows how to read, and he's not enjoying the wealth of things that can come to him from being able to read well and to enjoy more than just a simple text. So thank you for finding a way to use this money to benefit a group of people who are not typically enjoying their civil rights, and hardly anyone wants to invest in them. We diminish who we are as Americans because we want to enjoy diversity less. So thank you for holding this flag up and flying it strong for us. Madam Chair, I move that we move this forward to the full body of council, and I hope that all of my colleagues will sponsor this as I have.
All right, is there a second?
Second.
Madam Chair.
There's a second. Yes, Councilman Miller?
And I would like to have my name added, please.
All right, it's been moved and seconded. All in favor, please say aye.
Hi.
Thank you very, very much. And we promise next time it will be more substantive. Thank you so much, Council.
You're welcome.
Council people.
Resolution 2022-0285, awarding a total sum not to exceed $47,280.43 to the East Cleveland Domestic Violence Program for the purpose of supporting operational expenses from the District 10 ARPA Community Grant Fund.
Please state your name for the record. Make sure the green light is on, and you have more than 3 minutes.
Excuse me, ma'am, can you lower the microphone and speak directly into it? Thank you.
Oh, I saw a green light.
That's okay.
We'll do this again.
Yes.
Good afternoon.
Good
My name
afternoon.
is Deborah Black. I'm the director of the East Cleveland Domestic Violence Program, and I'd like to thank council for allowing me this opportunity this afternoon. The East Cleveland Domestic Violence Program is a program that has been around, and it was founded by the UNHR, the retired Honorable Judge Una H.R. Keenan, East Cleveland, and the late Yasmin Akir. We've been around since 1983. I've been there since 1996. We're a staff of 3, and we're VOCA funded. But over the last 2 years, as we all know, a lot of funding has been cut, and we were cut drastically. But we continue to move on because East Cleveland is one of within the Cuyahoga County, it has the highest rate of domestic violence per capita in any other municipality. We're a staff of 3. We deal with a lot of generational. I've been there since '86, and I'm dealing with grandchildren of people that I started out working with. We're making some progress, but it's slow and it's tedious. But I love doing what I do because East Cleveland is a place that this unit, although we serve all victims, we serve a predominantly Black community where we are culturally correct. And we find that that's very, very important a lot of times for people who are fearful of our government as a whole, and particularly the judicial system. So when they can look at someone that looks like them, a lot of times we can get some things done. We've had, it's hard to say this, because because of the pandemic, some of our funding stretched a little, such as our bus tickets. We haven't been able to buy bus tickets for victims for 2 years. But because we do Zoom groups right now, we were going to open them up back up to in person, but we couldn't because the numbers started to go up again this summer. So we held off on that. And because we don't do in-person groups anymore, we were able to stretch bus tickets for court and for coming to pick up packages and information and everything because of the pandemic. And that's really a sad thing to say. The pandemic helped us out in that respect. We work close with the police department. We start from the very beginning when the report is taken. We work in collaboration with the police department, the prosecutor's office, and the court. We're court advocates. We follow through with victims until the end of that case, and some victims for several years, because we have victims that call us back to deal with situations that might be taking place as a result of the trauma that might have taken place as a result of a domestic violence situation. We do victim support groups. We've created an anger support group. It's not anger management, but it's an anger support group because through the years, we found out that a lot of these women and men as well, who have started out as domestic violence victims have started to fight back, and they're being charged because their children have gotten old enough now to intervene to try to protect a victim. And some women, you can jump on me and you can beat me, but when you touch my child, now we have a problem, and I will fight back. So we do a lot of things. We work in collaboration we work with Children and Family Services. We do a lot of their domestic violence victim support. There's just so much. I mean, I didn't do a presentation, but we deal with housing, everything, anything that encompasses domestic violence. If they come to us, that's not what we're designed for. But like I said, we're culturally correct. Sometimes we gotta just dig through everything to find what we need for our victims. And so we're coming to you because I've had to cut hours. My hours haven't been cut because I have to work, but I've cut my wages. But I've had to cut the hours of the 2 people that work for me. I've had to cut their salaries. And I'm so grateful for these 2 ladies that work for me because they are so dedicated and passionate about this job. They continue to work and work diligently. And as you know, for the past 2 years, there's been a struggle throughout the state of Ohio for victim services across the board, not just us. but we continue to press forward, to work diligently so that we can protect maintain the safety and the dignity of victims so that it's not compromised, and so, I don't know. I'm used to writing on pieces of paper and sending it in, and then they give us funding, and then they tell me,
You're
hey, you
doing
gotta come
fine.
down here.
You're fine.
Okay.
Yes.
Madam Chair, let's ask her a couple questions.
Yes. I had one. Do you have any collaborations with Journeys? The
Journey,
Journeys
yes.
Center? Okay.
Yes, we do referral. We do a lot of wraparound services.
Okay.
So, yes, because we can't do everything. And that's what I'm saying. When we claw through everything, we're looking for whatever we can. That's why I was back there taking notes on some of the things that they were talking, people who were standing before you.
Yeah, and this has always been a passion of mine to find some sustainable funding for women, men, children, all victims of domestic violence, because we only have, it's sad to say, as large as this county is, we only have 45 beds for domestic violence, and that's sad. I'm going to open it up to any questions for my colleagues.
No, I'm prepared to make a motion for a vote.
All right. Anything else you'd like to share?
Well, I'd like to say I just thank you for even considering us, And you guys do a great job. So
thank
does
you.
everyone else that came in here. So I wish them the best, because I've heard some.
Not many people know about county council, but hopefully with all 11 of us and the various initiatives that we've most tried to gear to touch the communities and the individuals, that they will recognize that county government does play a significant role in their lives other than just collecting taxes. So I'll turn it over to my colleague to make a motion.
Madam Chair, with your permission, I move that we move this to the body of the whole to go through the process of 3 hearings. And I especially want to thank you for the work that your agency does on behalf of our communities. The counseling and the provision of additional support to these families may break the chain. We never know exactly what breaks those chains, but if we do not have agencies that provide counseling, therapy, and support, we will never break the chains of violence. Thank you so much for your work.
Second.
Okay, moved by Stevens, seconded by Miller. All in favor, please say aye. Aye. And I'd like my name added, Sharon, please. Thank you for coming down and presenting.
Thank you.
Madam
Chair
Chair.
would like my name added as well.
Madam Chair.
All right, all of us.
I'd like my name added as well.
Resolution 2022-0327, authorizing a grant award with Western Reserve Area Agency on Aging in the amount not to exceed $2,103,000 to support various mission activities commencing upon contract signature of all parties through April 30th, 2023.
State your name, make sure the green light's on, and you have more than 3 minutes. And welcome.
Hello, Chairwoman. How are you today?
I'm good. And yourself?
Good, good, good. My name is Myron Bennett. I'm representing the Western Reserve Area Agency on Aging. I'd like to say good afternoon, Councilwoman Turner, Vice President Stevens, and Councilman Miller. What I'm presenting today are a couple of projects that we have that will address the needs of seniors, allowing them to stay in their homes safely. Just a couple of, a little bit of information. Our services and programs give older adults and persons with disabilities access to information, assistance, consultation, and long-term care services and support. In the county, in Cuyahoga County, more than 300,000 citizens are over the age of 60, which represents over 26% of the population. 10,000 individuals are retiring each day in Cuyahoga County. More than 190,000 people are disabled, and that is the largest number of disabled individuals in a county in the state of Ohio. COVID exposed significant vulnerabilities for seniors and disabled citizens in Cuyahoga County. And one of the other things that's really significant is that issues related to falls and trips are the second largest cause of death in the world. So some of our programs will address significant needs to allow seniors to stay in their homes. One of the significant needs that we noted with COVID was that while we were asking senior citizens to stay at home, we were also cutting off their access to food. And so a lot of seniors became food insecure. A lot of people think about programs such as Meals on Wheels, but not all seniors are eligible for Meals on Wheels. And so we put together significant programs, some funded through the county, that address the food insecurity needs of seniors. One of the programs is a program that we're presenting today, which is called the Great Grocery Giveaway. I talked about falls being a significant cause of death, and certain modifications to the home can prevent falls, such as guardrails, shower rails, ADA modifications of toilets, wheelchair ramps, not the major repairs that you might need, such as roofs and hot water heaters, but safety types of modifications. And so one of the programs that we're presenting today is called Nails It, which will work with community CDCs in order to assist them with providing modification support for seniors living in their communities. We have targeted the city of East Cleveland, the Union Miles community, the Buckeye, Mount Pleasant community, Lee Harvard, and Slavic Village for that program. And then one of the other significant needs of seniors relates to transportation to medical appointments, transportation to the grocery store, transportation in order to pick up prescriptions. And so we have a program that's called Going Places. And with that program, we're hoping to purchase vans that will be readily available to seniors through the federally qualified health centers such as Care Alliance. In addition, we will be working with Senior Transportation to support them. They have a shortage of vehicles, and so we're hoping that the funds from the Arpa dollars will support that. So those are the programs that we're presenting. Again, they're Nails It, which is the home modification program, Going Places, which will be the Senior Transportation program, and then the Great Grocery Giveaway, which will provide support for food insecure seniors. In addition, we will be providing sanitation and hygiene products in those boxes that we will be providing.
I just want to ask you a question about the Workforce and Home Repair Initiative. Who do you what other agencies do you collaborate with? I mean, you hopefully will, as this moves forward, we'll be blessed with this amount of money to put toward these various programs. But there are other programs out there that have been funded kind of for senior home repair. So how do you collaborate that to, I'm a leverager. Let's leverage the dollar. So
Absolutely.
Do you do something like that?
So what we've done is we're working with all of the CDCs in these communities. One of the things is that even though there are other programs, a lot of the programs have lengthy waiting lists. Mm-hmm. For a senior to wait for a grab bar to keep them from falling could be the difference between hospitalization or permanent disability. And so what we're trying to do is we're going to be developing MOUs with the CDCs in order to pick up their backlog. A lot of them have significant waiting times for home modifications and repair. So we're working with the CDCs. In addition, we're working with Cleveland Neighborhood Progress. They have a program where they identify contractors and they work with contractors in order to make certain that the contractors are prepared and are trained in order to provide the kinds of services that we're looking for. Because when you look at ADA types of modifications, they're a little different than just a regular home repair. So we have to make certain that we have skilled, experienced contractors for that. So we're working with that organization. And then in addition, we are going to be working with the local urban league in order to make certain that we have minority contractors and female contractors engaged.
And what about the Cleveland Housing Network?
Cleveland Housing Network is also one of the groups.
Okay.
And also, we're going to be working with the county land bank because they also have
Right.
a program.
Okay, so it
we've
looks like
already
you
met with them.
connect with all the partners that are working on some.
Absolutely.
Okay, and
Absolutely.
that's what I was getting at.
So what we're trying to do is, because in some, with some of the programs, there is a kind of a poverty gauge. And so what we're trying to do is for those seniors who may not quite be at that level, at that poverty level, but have the significant need, we're going to make certain that we can support them. And then, of course, like I was saying, all the organizations have a waiting list, have a significant waiting list, so we're trying to help them with their backlog.
And what about the Department of Senior and Adult Services?
Yes, we're working with them also. Actually, I've had several conversations with them.
Okay.
And so what they're going to do is make certain that that information is sent out to their population to make them aware of the fact that in these communities there will be access to these services.
Okay, very good. I'm going to open up for questions for my colleagues. Hearing none.
You know I'm a believer in this already.
Oh, yes, we're definitely believers. So you mentioned, and I apologize, I missed one or maybe two, East Cleveland, Buckeye, Slavic Village, and what was your other?
Bell Burton Carr, which will be the Buckeye Mount Pleasant, and then the Lee Harvard area, which will be Harvard Community Services Center and their CDC. So 4
Madam
Cleveland
Chair?
CDCs and then the city of East Cleveland.
Okay, very good.
Have you interacted at all with, excuse me, Madam Chair, any with HRRC in Cleveland Heights?
Sorry, with?
Heights Repair Resource Center?
I have
In
not.
Cleveland Heights.
So I would check
They
into
have a fabulous program for low-income folks. They actually find financing for some of the repairs, and if they could match with a program similar to this, they could actually get more done in homes.
And what we're hoping is that, because some of these are, some people consider minor modifications, and so what we're hoping is that the funds that a lot of the organizations that you may already fund can go to the major modifications. And so that they can put in more hot water heaters, they can repair more roofs versus having to spend their money on toilets and grab bars.
Leverage those dollars. So I definitely like to add my name to this legislation. Any of my other colleagues would
please.
like?
Yes.
All right. The 3 ladies, Councilman Miller?
Yes, please.
All right, all round. And so I'll make a motion to, unless there's anything else you'd like to share?
No, I think.
Resolution 2022-0327 to the full council. Is there a time limit on this? I didn't look at the date.
It says April 30th.
Oh, you need to be retroactive.
Well, no, it says 4/30/2023. So we're ahead.
Well, no,
No.
that's when the funding will expire.
Okay,
Yes.
so pass this to the full council, second reading suspension. Is there a second?
Second.
All in favor, please say aye.
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 All right.
Okay, thank you.
I thought we were on time for something.
I know, dear.
Resolution 2022-0328, authorizing an amendment to master contract with various providers for emergency assistance services for the period September 1st, 2021 through August 31st, 2022, to extend the time period to August 31st, 2023, and for additional funds in the total amount not to exceed $1,575,000.
Good afternoon, David Merriman, Department of Health and Human Services. I'm here on behalf of the Department of Children and Family Services. The interim director, Jackie Fletcher, was here but got called out on a matter. She will be back shortly. On this item and the next item, Marcos Cortez will speak to the items process and where we stand with the contracts. I know for this item, we'll be joined by Chris Cabot, who is the Deputy Director for Children and Family Services, and then Paul Bounds for the next item. I'll be staying here for any additional questions, but I'm going to go ahead and turn it over to Marcos Cortez.
Good afternoon. Marcos Cortez with Health and Human Services on behalf of Children and Family Services. Again, this is an amendment to a master contract for emergency assistance. This contract provides emergency assistance services to families involved with DCFS and at risk for becoming involved with DCFS. The emergency assistance includes clothing, food, furniture, and basic appliances. So again, to divert families from further involvement in DCFS and to help caregivers better meet the needs of their children in their care. Food is provided in the form of gift cards in increments of $25. Clothing can be purchased via county-approved purchase vouchers. Furniture and appliance can be provided in accordance with an established product list. This amendment is to extend the time and to add additional funds. We are exercising the first of 2 option years for this contract. Again, we have Chris Cabot here who can answer more specific questions on the program itself.
All right.
Madam Chair,
Yes, Councilwoman.
as we know, this is a contract that has been renewed and renewed and renewed. I'm just curious as to why we don't have more than one supermarket / food service provider on here, like an Aldi's or a Save More or one of the others. I like Dave's, and I think they are located in most of the urban core neighborhoods that we need to serve, but so are some of the others now. Why have we chosen not to expand this?
So my understanding that originally we're just completing the first year of this contract, and I believe it was procured through an RFP.
Okay.
And so when
If
we
they
do
didn't apply, that's
if they didn't
different
apply, they
from-
wouldn't be on, they may have applied, they may not have made the cut, but, so we're just amending this one with the existing providers.
Do you know whether they applied?
My name is Chris Cabot, Deputy Director of Children's Services. My understanding is that Dave's was the only vendor that applied for this contract at that time.
Thank you.
All right, my question would be, was there any, if there's any funds left over from the last contract, does that automatically move over, or what happens with that, with the master contracts?
So with the changes recently for when the budget year closes for 2022, that money is gone. That's no longer available, so we have to move into the new year. Technically, it's still there, but they don't like us to apply invoices to those previous years. We have to go forward with the invoices for the new budget year.
Okay, so I want to make sure, so you're saying that there was some funds that may have been left over?
There may have been.
Goes back to the Health and Human Service Fund?
I guess it goes back into the
General fund or
yeah.
whatever. Okay, can we have, for the last couple of years, can we have how much funds were left over in each category? And because my concern is, I don't want us to get like other agencies, the needs out there, and we all know the needs out there, and so there should be no reason that funds go back. So
Unless you're telling us it's a very minimal amount, like less than $10,000.
Yeah, I'd have to look at specifically in the system to see how much is left in each. I don't know if you know.
Yes, if I may, in the Dave's Fund, of the initial amount of $83,333, $68,000 has been utilized so far for this year up till it ends in 2022. So not very much is going to be left there. Now, if we talk about the clothing and the furniture, that's where there could be some substantial amounts left over, depending on who the vendor is.
Okay, so my concern is share with us how these funds are distributed. Who
Yeah.
comes and
So these funds are
accesses?
really, as Marco said earlier, was to prevent children from entering care, to support kinship families that take on relative children. So when those cases come to the attention of the Division of Children and Family Services, an assessment of the needs is done regarding clothing, furniture, safe bedding, cribs, packing place, furniture.
So are you notified directly by people reaching out and getting on that call system? Or Is that inclusive of the collabs that are already working with these families and they recommend families seek our services?
It can be both.
It could be
So,
both.
yeah, so people sometimes call on themselves because they have a need. Sometimes others call. We work definitely in collaboration with our community partners to provide services, support and services. Oftentimes, they are able to help, but sometimes the need is so great that we split the cost, or maybe the family doesn't have involvement with the county collaborative.
How does this connect with the PRC funds? Because I've always had an issue with individuals reaching out for PRC assistance and not getting it for whatever reason. I've met with the director or whatever. So how does this coincide or work together with the PRC funds that we have?
To David for Lifeline on this one.
And please clarify what PRC
Sure.
is for.
Again, David Merriman, that's prevention, retention, contingency. And I know that we have Paul Bounds here from JFS, and Paul administers the PRC programs through one of his offices, and so I may pull him up as well. The PRC funds are TANF dollars that sit in Job and Family Services and are available for emergency purchases for families. It's an entitlement service, so I would say there's no direct coordination with this program. Families are entitled to use PRC if eligible on a schedule. So some services they can get annually from PRC. Some things are semi-annually every couple of years or as needed. I think what the program you have in front of you in this service, the furniture, the food, the clothing, this is really tied directly to a child welfare case. It's not going to be available to the general public in the way that the PRC is made available.
That helps a lot. That's more understandable.
And we will answer the question about if there are funds available in the master service agreement. Again, although there might be individual contract amounts for each of these providers, it is a master service agreement, so it is one contract, so that if one provider goes over a little bit, there's the ability to pull from a provider that's underutilizing their dollars.
Well, what helps us out is that we know that this particular contract that comes before us is connected with the child welfare cases.
That's
so
right.
we know that we don't have to worry too much that there's any funding left, because we know the social workers are dealing directly with connecting all those families to utilize the resources.
That's
so
right.
that helps a whole lot. Okay, thank you. Any of my colleagues have any additional questions? All right.
Madam Chair, I move
Yes, please.
this legislation move on to the full county council. Do we have a time need?
Probably second reading suspension.
That would be great, yes.
Yeah, we're getting used to it. I will move this for the suspended reading so that they have access to these funds to take care of these families and children.
Is there a second?
Second.
All right, it's been moved by Stevens, seconded by Miller. All in favor to move this to the full council under second reading suspension, please say aye.
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 Right, thank you. Thank you, gentlemen.
Resolution 2022-0329, authorizing an amendment to a master contract with various providers for the Comprehensive Case Management Employment Program, Employment, Education, and Training Services for Young Adults for the period April 1st, 2022 through December 31st, 2023, for additional funds in the total amount not to exceed $819,123.
Good afternoon again. Marcos Cortez with Health and Human Services on behalf of Cuyahoga Jobs and Family Services. Again, this is an amendment to a master contract for the Summer Youth Employment Program. This program seeks to provide youth with comprehensive, high-quality services that will help them escape poverty by making progress on a career pathway to sustainable employment, including attaining and retaining paid employment at good wages, meaningful work experiences, attainment of credentials for in-demand occupations, educational advancement, and development of transferable and soft skills, critical thinking, and self-advocacy. The youth to be served are range in ages from 14 to 17, as long as the youth is a minor child in a needy family. Youth ages 18 to 24 that have a minor child and are considered needy. Youth ages 18 to 24, as long as they are in a needy family that also has a minor child. Specifically, this amendment is to add an additional $819,123 to YOU. We have representatives here from YOU to talk more specifically on the program itself.
All right, and the reason, Marcos, is for the amendment of additional funds?
Excuse me, can you repeat that question?
What is the purpose of the amendment for the additional funds?
So there were additional dollars that were made available that were specifically targeted for YOU for them to continue to operate the program at the level that they had specified.
Okay, and how are these funds? Are they from HHS levy funds or
I believe they are WIOA funds.
WIOA funds?
Oh, you know what, Paul Bounds is probably have better knowledge on the funding source.
Okay.
Madam Chair?
Yes, Councilman Miller?
Why is Verge listed in the legislation but no dollars?
So this is part of a master, so these two are part of this one master contract. Verge has to be listed even though they're not getting any funding.
Okay.
Additional funding
Okay, okay, so they don't need any at this time?
at this time, yes.
Okay.
Thank you, Marcos. Madam Chair, Council, Paul Bounds, Deputy Administrator, Cuyahoga Job and Family Services. The dollars, this particular pool of dollars are earmarked from the Office of Family Assistance. It's made available through their TANF reallocation that's done annually, and that's how and where the dollars come from. Typically, this summer employment program is funded through a combination of WIOA and TANF dollars through the Office of Job and Family Services, but this particular pool of funding is made available through the Office of Family Assistance.
Okay, thank you. Any other questions? All right, anything else you'd like to share, Marcos?
Not at this time.
All right, I noticed the date, so I will make a motion to move R2022-0329 to the full council under second reading suspension. Is there a second?
Excuse me, we have Craig Dorn from YOU if you have any specific
All right, we
questions on
can
the
hold
program.
that. Who made the second?
I did.
Bring him up.
Craig.
Just wanted to get those first and seconds out.
Good afternoon, Craig Dorn, President and CEO of YOU. Thank you. Go ahead and vote, and I'll talk to you after you vote. That's fine. That's the best way to do it. But just wanted to take a moment to share a couple of things. First, as always, thank you for your generous support. This funding did allow us to serve 182 additional youth this summer, so it was a fabulous opportunity. And they worked at a variety of jobs this summer. And as we talked about in April or May, when we came before you, more than ever before, jobs are in career areas like IT, construction trades, healthcare, with a lot of partners. I know Councilwoman Chair Connell, you were asking a lot of the people coming up previously who you partner with. We this year had over 100 community partners from every corner of the county. So just wanted to say thank you again for your strong support of this program.
Always. We always want the youth to expand and work out in the community and get some experience as well as their educational. So we always value you guys. Okay, so any other comments? All right. It's been moved by me, seconded by Miller. All in favor to move this to the full council under second reading suspension, please say aye.
Aye.
Madam Chair, would you please add my name to this
Okay,
legislation?
please add Councilwoman Turner and Conwell. I always get on this one.
You can add Stevens.
All of us, just stick us on there.
Yes, me as well.
All right. And I just wanted to ask a question. I don't think I've noticed this before. The presentation, that's just something that you guys added to the agenda in case we have a presentation?
Correct.
Okay, I was like, I don't remember a presentation. All right. Any miscellaneous business? I don't think there's any. This meeting is adjourned.